Hey y'all, welcome to today's low back pain relief flow during pregnancy. I'm actually 16 weeks pregnant myself with baby number 3. I'm Dr. Mae Hughes, a pelvic floor physical therapist, and the equipment that you will need today is a yoga block and a Pilates ball, as well as some sort of bench or ottoman or chair, something that you can do a hip thrust off of. But if you don't have that, I'll also show you an alternative. Low back pain is one of the most common things that occurs during pregnancy, and it's usually just due to change in our posture. You tend to develop what is more of an anterior pelvic tilt, where the belly tips you forward and you stick your booty out, and that just causes a lot of compression on your lower back. And then you add in things like maybe you've got other kiddos at home, like a toddler, or you work a job that requires a lot of heavy lifting, and so it can just put a lot of pressure on your lower back. So we're going to start by working on some mobility to relieve some of that pressure, and then we will work on some stability and strengthening to hopefully maintain some of that increased mobility we have just gained. But let's go ahead and get started with some rock back breathing. So what this looks like is you can grab that yoga block. You're going to place it between your forearms like this, so your palms are facing up. You're going to sit back on your heels, rest your forehead on that yoga block. Of course, if you don't have a yoga block, you can still perform this exercise. You just won't have anywhere to rest your head. So rest your forehead on that block, round that spine, and you're going to inhale through your nose, expanding your ribs, back, and anal sphincter 360 degrees, and then exhale, let it go. We're focusing on improving soft tissue mobility in the lower back here. We're restoring full body mobility, releasing lower back tension, learning how to relax and lengthen your pelvic floor is so important during pregnancy, especially when it comes time for pushing. With every inhale, try and drive your breath down into this lower back region. Maybe even put your hand there as a cue to breathe into this area. And exhale, let it go. Go ahead and move that block out of the way. And meet me on your side. Doesn't matter which side, because we will do both. For a windmill, you're going to bring both of your knees in close towards your chest. Extend both of your arms out long. You're going to reach that arm up and overhead, following it with your head, and then returning to start. Work on improving thoracic mobility here. If you lose mobility at the top part of your spine, your thoracic area, it leads to compensation from your lower back. So you want to keep the upper back mobile and happy. That way the lower back doesn't have to compensate. Switching sides in 4, 3, 2, 1. Roll to your other side. Take your time. Knees in close to your chest, arms extended, reach up and over. Maybe you feel a little crack or pop in your back. I know I just did. Always feels so good. For 4, 3, 2, and 1. Meet me back in all fours. You'll keep a yoga block nearby, but you won't need it for this first exercise. We're just going to focus on a quadruped pelvic tilt. So hips over knees, shoulders over wrist, spine is long, and you're just going to work on gently tucking the pelvis underneath of you and then reversing that movement. So this is not a cat-cow quite yet. We're just isolating the movement to your pelvis, staying long through that spine, using your exhale to gently tuck the pelvis underneath of you. It becomes really hard to get into that posterior pelvic tilt during pregnancy, and honestly just in general. So that's kind of what we are working on here, going from an anterior to a posterior pelvic tilt. For 5, 4, 3, 2, and 1. Now grab your yoga block. If you don't have one, that's okay. You can still do this exercise just without the yoga block. You're going to place it underneath one of your knees. We'll do it on both sides. So you're staying in this all fours position. Then you're going to shift your weight slightly over that elevated knee and perform a cat-cow here. So inhale, drop the belly, chest, look up towards the ceiling. Exhale, round and tuck. Like I said, if you don't have a yoga block, that's okay. You can still just perform a regular cat-cow. Just know that the yoga block does help to isolate the side of the pelvic floor that is elevated to get just a little bit more release. For 4, 3, 2, and 1. Switch sides. You're going to place it underneath of the other knee, hips over knees, shoulders over wrists. Inhale, drop the belly, chest, look up towards the ceiling. Make sure you're shifted your weight towards that elevated knee. You should really feel the sits bones spread on the side of the elevated knee. For 5, 4, 3, 2, and 1. Last exercise for our mobility session, and that is going to be a half kneeling hip flexor stretch. So let's start with the right knee forward. You're going to gently tuck your pelvis underneath of you without clenching your glutes. Then reach the opposite arm up towards the ceiling and over, and then slightly lean forward. You should feel a good stretch through the front of that left hip flexor. Now you don't want to crunch fully into your side, so stay tall and elongated with just a slight bend. You're also going to feel a good side body stretch, improving that rib cage mobility. Breathe here. Switching sides in 4, 3, 2, and 1. Left knee goes forward, gently tuck the pelvis. Reach up and over with that right arm. Slightly lean forward without exaggeratingly arching that back. So ribs still stay tucked and in line with your pelvis. You're just shifting the whole body forward to feel that good hip flexor stretch. For 5, 4, 3, 2, and 1. Alrighty, so we've created some mobility in our side body, our pelvic floor, our glutes, lower back. So now we're going to work on some stability. So you're going to have that Pilates ball nearby, and you're going to meet me on your back. Slowly make your way down there, depending on how big your belly is. Alrighty, you're going to place the Pilates ball between your knees. Feet are flat on the mat, hands on either sides of your ribs. Inhale through your nose, expanding the ribs 360 degrees. Exhale through pursed lips as you gently squeeze the ball and zip up your core. Ribs knit together at the very end. Inhale, expand. Exhale, gently squeeze the ball, lift the pelvic floor up and in, and imagine there's a zipper going from your pubic bone all the way up to your sternum, and you are slowly zippering it up. Inhale, expand. Exhale, breathe out through pursed lips like you're blowing out a birthday candle. Ribs come down at the very end. Inhale, expand. Exhale. Working on improving our deep core contraction. One more inhale. Exhale. From here, you can remove that Pilates ball. Now we're going to work on a march. What this will look like is you're going to inhale, exhale, zip up the core just like we were doing, maintain that deep core contraction, and now march one knee at a time, keeping the pelvis as still as possible. Now, if being on your back flat like this is starting to bother you, I want you to go ahead and place the Pilates ball right at the part where the mid-back meets the lower back. And from here, you're going to maintain that deep core contraction and march. Remember, the goal is to keep your pelvis as still as possible, so you're not letting your pelvis shift from side to side. You're really focusing on that lower core, deep core contraction every time you exhale and march. You really should start to feel this in that lower core. We call this hugging the baby when you exhale and contract, that deep contraction, because it's like you're bringing your baby closer in, and you'll notice your belly kind of shrink. It's not sucking in. It's not what it is. Keep those ribs down. For 5, 4, 3, 2, and 1. Moving on to a hip thrust. So you're going to place your upper back along the bench or ottoman or whatever you have nearby, and place the flies ball between your knees, working on some good hinge and glute strength. Upper back is along the bench. Inhale, prepare. Exhale, squeeze the Pilates ball as you press your feet through the ground and thrust your hips up towards the ceiling. Inhale, lower. Imagine you are pressing your feet through the floor, 3 points of contact, big toe, pinky toe, and heel. So you're not shifting your weight towards the outside of your foot or towards your heel. It's right through the middle part of that foot. Maintaining a gentle squeeze of that ball and a little tuck of the pelvis to initiate the movement as you thrust up. Glute strength is also really important for lower back and pelvic health, and learning how to find length through a hinge motion, just like this. For 4, 3, 2, and 1. Back onto your mat, slowly make your way over there. For a quadruped alternating arm lift. Pilates ball between the knees, hips over knees, shoulders over wrist. Inhale here. Exhale, gently squeeze the balls, you zip up your core. Now maintain this deep core engagement, alternate extending one arm and then the other. Pressing your hand through the floor, keeping your pelvis as still as possible. What I'll tell my patients is to imagine they had a glass of water on your back and you're trying not to let it spill over. So that might mean you have to slow down, move with more control, but that is what we want. We're creating more stability through our core to better support your lower back during pregnancy. For 4, 3, 2, and 1. Moving on to our final exercise of stability before we cool down. A full bird dog. So we just did the arms just now. Now we're going to extend the opposite arm and leg. Still in this all fours position. Hips over knees, shoulders over wrists. Inhale, expand. Exhale, zip up the core. So you feel like there's no air left. Maintain that deep core engagement. Extend opposite arm and leg, lifting your foot and arm no higher than the height of your hip. A common compensation or incorrect form that I notice is when people lift their arm and leg really high. And what that happens is you're just really getting a lot of lower back extension. We don't want that. We're just trying to create some posterior oblique sling stability from running from one lat to the opposite glute and to help better support the back side of your pelvis. I'm exhaling every time I extend. Inhaling as I return to neutral, slow and controlled. Keeping the core engaged. Not lifting the foot any higher than the height of your hip. For 5, 4, 3, 2, and 1. Finishing off with a child's pose. We always finish off with some breathing to restore full mobility to the pelvic floor and release any tension that may have developed. So sit back on those heels, walk those arms out long, rest your forehead on the mat if that feels good for you. You might need to move your knees a little wider to accommodate your belly. I know I do at this point. Really sink into this pose. Inhale through the nose, expand the ribs, and exhale, let it all go. Inhale, expand, feel the lower back, pelvic floor, ribs, all release. Exhale, let it go. Inhale, breathe into the lats, which are this muscle right underneath of your armpit. It's much bigger than that, but if you breathe into your armpit, it's a pretty good cue to feel the lats expand. They actually are a muscle that attach all the way down to your pelvis. And tension in your lats can contribute to tension in your lower back. Last one together. Inhale, expand. Exhale, release. Amazing, y'all. I hope this mobility flow provided you with a little bit of pain relief. And this is a very low lift mobility flow, so you really can perform this daily to improve overall mobility and stability throughout your pregnancy journey. If you have any questions about the movements or the workouts or pregnancy in general, please drop a comment below and I will try and answer as many comments as I can. And if you found this mobility flow helpful, I encourage you to check out my Movement Through Pregnancy program. It's a 37-week prenatal program with 4 workouts for every single week of pregnancy. I filmed it while I was pregnant myself during my second pregnancy, so I'm at the exact stage of pregnancy that you are. And the workouts are designed to work your full body while still integrating pelvic health. I will drop a link below, and I will see y'all next time.